Morning, there are more than 1,200 COVID-19 cases in Maryland, and 15 people have died. Meantime, workers in Carroll County are handling an outbreak of coronavirus at a nursing home. WJZ is live at Pleasant View Nursing Home. Mike Hsu reports on the dozens of cases there and also has the latest from Governor Larry Hogan. Mike?
Good morning, Lynn. State police are blocking the driveway here. This outbreak has echoes of one at a Seattle nursing home, and in that case, 35 people died. Here in Mount Airy, one person has died, but 66 people have tested positive, and that is alarming considering that this virus attacks the elderly and their mortality rate is much higher.
A coronavirus cluster in a nursing home is exactly what worries health officials.
And this is extremely serious because of the vulnerable nature.
The outbreak happened here at the Pleasant View Nursing Home in Mount Airy. 66 residents test positive. 17 are taken to 2 local hospitals, and a man in his 90s with underlying health conditions has died.
If somebody's in a nursing home, they're there for underlying medical conditions. So we have 66 people with underlying medical conditions who are infected with this virus.
The home is still open, so to try to protect the staff, local hospitals are providing equipment.
Anything necessary to try to help them provide the care, as well as continue to try to prepare ourselves for any influx in patients.
Across the state as of Sunday, there are now over 1,200 confirmed cases and 15 deaths. Governor Larry Hogan says it's going to get worse. Much worse.
We think in 2 weeks around Easter, we're going to be looking a lot more like New York.
Health officials here say that some of the people who were tested did not show any symptoms. I'm Mike Hsu reporting live from Carroll County for WJZ.
Mike, thank you. Baltimore City Schools has its first confirmed case of coronavirus. Also, a resident at a senior assisted living facility in Baltimore County tested positive. WJZ's team coverage continues. Amy Kawada is live with the latest on these new cases. Amy.
Good morning, Lynn. I'm here in Parkville near the Oakcrest Senior Living community where over the weekend residents received a letter announcing that a person who lived in the community has tested positive for the coronavirus. Now, this comes as Baltimore City leaders also learned that a staff member at a school has also tested positive.
Baltimore City school officials say a staff member at Cherry Hill Elementary Middle School tested positive for COVID-19. The city health department says the person contracted the illness after schools closed on March 16th. Based on an investigation by the Baltimore City Health Department, when the individual began to show symptoms, the employee contracted the virus 3 days after schools were closed. Officials say all buildings are being thoroughly cleaned and sanitized for use both now and when students return. And multiple people are being treated for the coronavirus at Clifton T. Perkins Hospital Center in Jessup. A spokesperson for the Howard County Health Department didn't have an exact number, but says the patients are both healthcare workers and inmates at the psychiatric hospital.
And taking you back to the Oakcrest Senior Living community here in Parkville, we're told that no other residents have tested positive for the virus. However, the resident who contracted the coronavirus is currently in care and receiving treatment. Reporting live this morning, I'm Amy Kawada for WJZ.
Thank you, Amy. 6:35 now. This week was the end of the White House's 15-day initiative to slow the spread of the coronavirus. But President Trump says he's extending the guidelines on social distancing until the end of April. Gwen Baumgartner reports for WJZ.
President Trump has backed off his goal of reopening the country by Easter.
Nothing would be worse than declaring victory before the victory is won.
The president extended the federal social distancing guidelines until the end of April.
When you hear these kind of numbers and you hear the potential travesty, we don't want to do anything where, we don't want to have a spike up.
The top medical experts on the White House coronavirus task force presented a grim projection.
Between 80,000 and 160,000, maybe even potentially 200,000 people succumbing to this. That's with mitigation.
Dr. Deborah Birx and Dr. Anthony Fauci say Americans need to stay vigilant and stay home.
You have the virus going up and you have the mitigation trying to push it down.
While Americans do their part to slow the spread, governors in some of the hardest hit areas are scrambling to help hospitals get the equipment they need.
We believe that by about April the 4th or so in the New Orleans area, we will exceed our capacity for ventilators.
My role is to get every personal protection equipment, every piece I can get into the state of Michigan.
It's a lack of tests, a lack of ventilators, a lack of masks.
New York is still the epicenter of the outbreak in the U.S. On Sunday, crews worked to build a field hospital in Central Park.
This is the kind of thing you will see now as this crisis develops and deepens.
President Trump says he hopes the U.S. will be on its way to recovery by June 1st. Gwen Baumgardner, CBS News.
The U.S. Treasury Secretary says Americans can expect coronavirus relief checks to begin showing up within the next 3 weeks. During a press conference yesterday, Steven Mnuchin says he wants small businesses to hire back workers after receiving the stimulus money. He's hoping the money can help Americans get through the next 8 to 10 weeks.
A commercial aircraft loaded with medical supplies from China touches down at New York's JFK Airport. It is the first of a series of flights carrying much-needed goods. More help is on the way, but as Meg Oliver reports for WJZ, the need is extreme.
This virus preys on the vulnerable.
On Sunday, a calm but stern New York Governor Andrew Cuomo extended the order for New York City to stay home until mid-April.
We're going to need 2 more weeks of non-essential workers.
Healthcare workers on the front lines are feeling the surge as an influx of COVID-19 patients fill hospitals in New York and New Jersey.
It's incredible, and it hits so fast.
The pandemic is changing the way Americans say their final goodbyes.
Oh, it's heartbreaking. That was the hardest part of all of this.
Alex Handy's mom, 86-year-old Lana Irwin, died from COVID-19 more than a week ago, only 3 hours after she learned the facility in Montclair, New Jersey had been exposed to the virus. Her mom was gone.
How hard was that not to be able to say goodbye to your mom?
The fact that she passed away, I can accept that, but the fact that I didn't get to say goodbye is still what's eating me up inside.
It's not just nursing homes and hospitals in New York and New Jersey under siege. The rest of the country is still bracing for the worst. Experts warn other big cities like Detroit, Chicago, and New Orleans are also emerging hotspots. Meg Oliver, CBS News, Montclair, New Jersey.
West Coast, the Naval hospital ship Mercy has docked in California, and it's ready to take on non-COVID patients because so many people still need those ICU beds. Earlier this weekend, the federal government sent 170 ventilators from its national stockpile to Los Angeles. However, those ventilators were broken. California's governor says they'll be fixed today. Meantime, in Washington state, officials announced the opening of a field hospital for non-COVID patients. And UPS also making changes. The shipping company announced it will no longer require signatures from customers. Instead, the drivers will make contact with the recipient and request ID if necessary. UPS says this move is only temporary. Stay with WJZ as we follow the latest on the coronavirus pandemic, and you can find everything you need to know at WJZ.com.